Good afternoon, everybody. Like to get started as soon as we can, so that's why I just babbled. Welcome to Labor and Commerce Subcommittee 2. We have a few bills, but just to echo what the chairwoman said earlier today for the full committee, we will have a great number of additional bills getting onto this docket, and so it's our intent to make sure that everyone is able to be heard on both sides of each issue. We'll try to give everyone an equal amount of time. I'd like to focus no more than 4 minutes per presentation, and then 3 minutes for and against. And if there are several folks, we'll try to be as flexible as possible. But one thing I'd like to encourage everyone to embrace is the example of the former chairs of this subcommittee and the full committee in the past, on both the Republican and the Democratic side, enforcing civility and making sure that we're able to have an open and respectful dialogue with folks. With that, I'd like to first address one bill, 1951, from Delegate Waxman. Is your intention still to strike the bill? All right. That's. Do we have a motion to strike HB 1951? Do you have a second? Moved and seconded. All those in favor say aye. All right. Is that on the board?
Yeah, it's a recorded vote.
Oh, I apologize. That's a recorded vote. All right, by a vote of 7-0, HB 1951 is stricken from the docket. All right, with that, I'd also like to take into account some chairs of other committees who have to move and for similarly timed subcommittee meetings. With that, I'd like to ask Delegate, and we'll just go out of order. We're going to go Delegate Delaney, then Delegate Krizik, and then Delegate Jones. Delegate Delaney could come up and present.
Thank you, Mr. Chair, and thank you for your flexibility so we can keep our other committees moving. So I have before you House Bill 1725, and I would like to introduce the substitute.
All right, moved and seconded. All those in favor say aye. Aye. All those opposed? All right, you may proceed.
Thank you, Mr. Chair. The substitute to simplify the list of collection actions that are banned by using all extraordinary collection actions, which is a list from the IRS. It is defined earlier in the bill, and then second on line 544 of the substitute, it strikes the word permissible extraordinary, and on line 44, extraordinary on line 546. And so it just kind of cleans up since we're replicating that same list of extraordinary collection actions. And then it does make some minor technical amendments, removing certain references that would prevent reporting medical debt to credit reporting agencies, since we passed that bill last year that would already prohibit that action. So that is the bill that is before you. And this bill, the Medical Debt Protection Act, protects patients from predatory collection actions through the following measures. It prevents interest or late fees on medical debt and requires payment plans to be offered and that they follow certain criteria. The bill will limit billing and collection actions that will be taken by creditors and buyers, and it prohibits collections during healthcare appeals. So when individuals fall into debt due to risky behavior or poor financial management, there are plenty of means that lenders can use to secure payments and recover their funds. However, when patients face medical emergencies or serious illness, they often incur astronomical medical debt through no fault of their own. Even though they did not welcome or seek out accidents or disease, they are still punished with extraordinary collection practices by medical debt creditors and buyers that create even more financial hardship for patients on top of the existing debt for their medical situations. Patients often become trapped by medical debt, and it can jeopardize their financial stability for years, even after their illness. So to lessen this undue burden, this bill would add patient protections around billing and collections, specifically protecting patients from accumulating interest, ensuring access to affordable payment plans, and guaranteeing core financial assets from extraordinary collection practices. So this bill prevents medical debt collectors from buying or charging interest fees or late fees on debt, would require to offer payment plans that do not exceed 5% of gross monthly income and would not start until 90 days after the health care is received. And additionally, each payment, service, and administration fee would not be allowed, and patients would be voluntarily allowed to make early payments at any time. The bill then prevents the use of this IRS list of definitions of extraordinary action collections. Medical debt buyers would be bound by those same rules, and it would require that the debt is recallable if an individual becomes eligible for financial assistance. Along with this, the bill creates a grace period before action can be taken, requires notice to be sent to patients, and requires excess payments be returned if the patient is later found eligible for financial assistance. And lastly, if there is a healthcare appeal, the bill prevents collection actions from selling medical debt prior to 60 days and after the appeal review. So these provisions are essential to ensuring patients are protected during this most vulnerable moment. Patients are not asking for a free ride or to escape paying their bills, but they need fair, affordable options that don't put them at risk for bankruptcy, all because they needed a cancer treatment or a surgery after a car accident.
Thank you, Delegate Delaney. Are there any questions from the committee? Delegate Ballard.
Thank you, Mr. Chairman. Just one question. I notice, I think I have the version that's the substitute, but it talks about that it's subject to enforcement provisions of the Consumer Protection Act. Can you just explain that part a little bit, please?
Yes, Mr. Chair. So this is basically ensuring that, that there are some teeth to the provision that we're offering here. And similar to what we did last year with the reporting of the medical debt, if there's a number of protections offered through the Consumer Protection Act that are enumerated in that code section. So any violations of this would be a violation of that act and would be subject to any of those potential penalties.
Thank you, Gail. Any further questions? Any further questions? Are there anyone in the audience here to speak in favor of the bill? Once again, I'd ask folks, if you're going to speak in favor or in opposition, please come up close.
Mr. Chair, members of the subcommittee, my name is Lauren Edwards with the Leukemia and Lymphoma Society. Thank you very much for all of your hard work. Medical debt is different than consumer debt, and we should treat it that way. Patients often, when they do file bankruptcy, that's following them for 10, 20, 30 years. We have patients that are still suffering the consequences, even though they beat cancer, they paid off their bills, but they still can't buy a home or they still can't buy a car. And so this gives patients the opportunity to fairly pay back the bills that they need to pay without those extreme actions that do jeopardize their future for years to come. So we ask the committee to support the bill.
Thank you.
Good afternoon, Mr. Chair and members of the subcommittee. Amanda Gago-Silcox with Virginia Poverty Law Center. And as you all know, medical debt is a massive problem. Americans owe nearly $200 billion in medical debt. And the repercussions of this staggering amount are severe. People avoid needed medical treatment. They cut back on normal household spending. They skip payments on other bills, and they make changes to their housing situations, like downgrading from a house to a smaller apartment. The stress makes people sicker and does lead to many, many people filing for bankruptcy. An estimated 40% of Virginians are struggling to make ends meet between skyrocketing rents, increasing utility bills, stagnant wages. There simply is no more money. People desperately want to pay their bills, but they need the protections and the pathways to stay successful in repayment. This bill will provide protections for Virginians from the most abusive debt collection practices and allows them to make reasonable and affordable payments towards their debt. And we ask that you support the bill. Thank you.
Thank you.
Good afternoon, Mr. Chairman. Jared Calfee with AARP Virginia. We support the bill. Virginians of all ages struggle with the sometimes crippling burden of medical debt. The last thing that a person trying to recover from a debilitating injury or illness should have to worry about is whether they're going to be financially ruined as a result of their medical care. And so we support the bill and hope the committee will pass it. Thank you.
Thank you.
Hello, Mr. Chairman and committee. I'm Kirsten Millar from the Virginia Breast Cancer Foundation, and for all the reasons mentioned before, we support this bill.
Thank you.
Mr. Chair, members of the committee, Kelly Fitzgerald, representing the American Cancer Society Cancer Action Network, along with my colleagues. Thank you so much for putting the bill in. We strongly support. Thank you.
Thank you very much. Before we go to people online to speak in favor or opposition, we'll go to the people in opposition here in the room. If you can come up close.
Good afternoon, Mr. Chair, members of the committee. Brent Rawlings with the Virginia Hospital and Healthcare Association. We are opposed to the legislation. Just to remind everyone, in 2022, the General Assembly passed a bill that put some limitations on medical debt collection practices for healthcare providers, and that exists in Virginia Code 32.1-137.09. And our primary opposition to this is that it conflicts with existing law. With this law, it prescribes that no interest fees on any prepayment plan. Existing law allows interest up to the judgment rate. This law offers a payment plan to any patient. Under current law, it's only prepayment plans are only made available to uninsured patients with the inability to pay. This law has a monthly payment cannot exceed 5% of gross monthly income. In the existing law, it allows the term and monthly payment amounts to be based upon the income of the individual, so it allows a sliding scale. Under this law, no initial payment before 90 days. There's no waiting period in current law. And then need to fact check this one, but just want to make sure that this law has extraordinary collection actions defined. A current law cites federal law. So overall, we see this conflict between two existing code provisions and two different sections of the code that need to be reconciled in order for this, in our mind, to be able to move forward. So again, we've already agreed to no extraordinary collection practices. That's already in the books. Also, we've already agreed to offer prepayment plans or payment plans to patients with the inability to pay. So again, we just need to reconcile those differences. Thank you.
Thank you.
Good afternoon, Mr. Chairman, members of the committee. Matt Benedetti, representing the Virginia Creditors Bar Association. We want to thank the patron for meeting with us earlier in the week and hearing our concerns about the introduced bill. She told us there was going to be a substitute, which we got earlier today, but we really haven't had a chance to digest it. But at current, we are opposed to the introduced bill and the substitute until we can kind of get more through it. But she has agreed to talk to us going forward, so we appreciate the efforts. Thanks.
Thank you. Sir.
Mr. Chairman, members of the subcommittee, Fred Helm on behalf of the Consumer Data Industry Association. Just want to advise the committee that this issue is under litigation in federal court, the issue being whether or not it is preempted by federal law. And we mentioned that to the patron.
Thank you.
Thank you.
All right. Anyone else? Okay. We have Mr. Alex Casper speaking in favor of the bill from the American Lung Association.
Good afternoon, Mr. Chair and members of the committee. Thank you so much for allowing me to make comments. My name is Alex Casper, and I represent the American Lung Association. And for many reasons that my colleagues in the room have already stated, we support this bill. We also did submit written comments that are much more extensive. And so I will keep my comments brief and just say that we represent patients with lung disease, and this bill protects them from negative impacts of medical debt. We thank Delegate Delaney for her championship on this issue and ask the committee to please support this bill.
Thank you, ma'am. Ms. Amy Yarsich from the Prescription Partnership.
Mr. Chair and members of the committee, Amy Yarsich, Executive Director with RX Partnership. I'm offering my support and the support of our organization. We work with many free clinics, community health centers, other groups that oftentimes see patients who are low-income, uninsured. They're coming to the clinic after dealing with some medical debt experiences that have actually caused them such anxiety. They have put off care. They're coming to the clinics much sicker than they otherwise might be and really needing such a high level of care, hearing heartbreaking stories about people who have almost lost their homes, who are scared to fill prescriptions because of the cost. And we can certainly step in to help, but there's such a huge need and issue. We realize that there are some existing laws, but we feel more is needed. And that's where we feel it's important to support this particular legislation, and there's room for improvement when it comes to medical debt.
Thank you, Ms. Yarsich. Are there any additional questions from members of the committee? All right. Is there a motion to report the bill?
Mr. Chair, I have a motion. I'd like to speak to the motion.
Speak to the motion.
I just want to thank the patron for bringing the bill. I grew up in a family that lived week to week, paycheck to paycheck, never had insurance, lived in a motel, just very unsteady. And we had a lot of medical debt. And there was a lot of times where we didn't go to the doctor because medical debt. Well, now my mom lives with us, and she's got a variety of health problems because she was never regularly at the doctor, and she still has the medical debt. So I just think it's really important that we think about how medical debt needs to be treated differently than the other consumer debt. I think that's one of the most important things I heard you say. So thank you, and I'd like to motion to report this bill.
So I've moved and seconded. Let's go to the big board. Oh, with substitute, I apologize. All right, by a vote of 5-2, HB 1725 from Delegate Delaney with substitute is reported.
Thank you, Mr. Chair, and thank you, committee.
Thank you. So we go now to Delegate Krizik. Delegate Krizik, you have HB 2060 regarding worker compensation benefits. And I will say to the committee, we have a letter from the Speaker. If this is reported, it has to go to appropriations.
Thank you, Mr. Chairman. Members of the subcommittee, I have HB 2060 before you. This aims to expand workers' compensation benefits for our law enforcement officers and firefighters in the Commonwealth. It's the same bill that passed this subcommittee last year unanimously. These firefighters and police are routinely eyewitnesses to scenes of catastrophic incidents involving serious injuries, loss of human life, and property loss, which can cause severe mental health trauma over the course of their careers. What this does is it expands the Virginia workers' compensation benefits related to anxiety disorder or depressive disorder for these first responders from 1 year to 2 years, and post-traumatic stress disorder benefits from 52 weeks to 500 weeks. When I say expand, it sounds like it's something, extra benefit that they get. No, it's not. It brings them into parity with everybody else. So right now, they're getting less benefits. This puts them at the same level as everybody else. I'll just give you an example. You could have a gas employee working for the gas company and a firefighter show up at the same fire, and they could both witness a colleague get killed in that fire. The gas employee is going to be able to go have its benefits over 52 weeks, and the firefighter is going to be capped. So this is really just a matter of fairness, and it really needs to happen. And I've got here before us from Jennifer Pike from the Virginia Professional Firefighters to testify in support. Thank you, Mr. Chairman.
Thank you. Any questions for the patron? All right. All those speaking in favor, thank you. Can you state your name and your organization again?
Yes, Mr. Chair, members of the committee, Jennifer Pike with the Virginia Professional Firefighters. Thank Delegate Krizik for bringing this bill back again this year. We've fought hard to expand these protections for the firefighters. As he stated, the current Workers' Compensation Act allows normal workers 500 weeks of PTSD coverage. Currently, firefighters and law enforcement are only getting 52. So this would expand this coverage. 52 weeks is not long enough. By the time they get into treatment, diagnosis, that sort of thing, the end of the 52 weeks is up. So we would appreciate you all passing this bill and appreciate him bringing it. Thank you.
Thank you very much.
Good afternoon, Mr. Chairman, members of the committee. Devin Cabot with Two Capitals Consulting here on behalf of the Virginia Fire Chiefs Association, and they support the bill. Thank you.
Mr. Chair, members of the subcommittee, David Ostwingle, Virginia State Police Association, we support the bill.
Thank you.
Mr. Chairman, Ed Rhodes, representing the Virginia Association of Rescue Squads and also the governmental EMS administrators, and we support the bill.
Thank you.
Good afternoon, Mr. Chairman and members of the subcommittee. I'm John Jones, representing the Virginia Sheriff's Association, and we support this.
Thank you. Anyone else in favor of the bill? All right. Anyone in opposition to the bill?
Mr. Chairman, Jeff Smith here on behalf of the Virginia Self-Insurers Association and Metis Holdings, a company that oversees all of VACO's risk liability pool. We are not opposed to the bill. I just wanted to thank the patron for bringing it again this year. We had worked with the firefighters last year on this compromise, and we don't have a position on the bill, but want to thank them for working with us and bringing it back. So,
Thank you very much. Anyone else? Anyone online?
No, sir.
All right, any additional questions or comments?
Move to report
Move to.
and refer to essentially.
So we.
Second.
All right, we have moved and seconded to report and refer the bill to appropriations. All those in favor say, sorry. Let's go to the big board. All right, by a vote of 7-0, the bill is reported and referred to appropriations. Thank you, Delegate Krizik.
Thank you, Mr. Chairman. Thank you, committee.
All right, Delegate Jones. HB 1667. Tell us what the bill does and why it'll make Virginia better.
Thank you, Mr. Chair and members. I have a line amendment.
Okay, what line?
The line amendment is to lines 98 and 99 and changes the sentence a little bit and corrects a cross-reference.
Say the child is employed pursuant to a, what's the change? Could you read the change?
Yes, after child is, insert participating in a regular work training program pursuant to 40.1-89.
Okay.
Yeah.
Any comments or objection to the line amendment? All those in favor of the line amendment say aye. Aye. All those opposed? All right, moving forward.
Thank you, Mr. Chair. I had an opportunity this past off session to meet with all the technical centers in my district, and the one thing that we were all challenged with is with the changing nature within the work environment and wanting to get young people the type of training they need. The one thing that prohibited this one particular class, this one particular industry within barbershops and the cosmetology field is the working with particular solutions and or solvents. And so what this bill would do is allow 16-year-olds to be employed as registered apprentices in licensed barbershops and cosmetology salons. They're already working with these solvents in a classroom in a controlled setting, and they would still be working within a controlled environment as an apprentice. So, sir, we just simply seek to move this by 2 years because a lot of our seniors are graduating at 16 and 17, and so we want to see them be productive in those years.
Thank you. Any questions for the patron? Delegate Ballard.
Thank you, Mr. Chairman. Delegate Jones, I mean, I know nothing about this, so genuine question. At the end of it, it says the child has obtained a cosmetology or barber license from the board, but then the child also has to be an apprentice. So, I mean, explain to me how that works. You have to be an apprentice and have a license? I mean, in my mind, I was thinking an apprentice would not have a license because you're an apprentice.
Mr. Chair, we have Stephen Kershaw with DPOR. Love to punt to him and allow him to answer that question.
Thank you. Good afternoon, Mr. Chair, members of the committee. Again, my name is Steve Kirshner. I'm with DPOR. Mr. Chair, in response to the question, the amendment that is before you, or the bill that's before you, would expand the different avenues that children ages 16 and 17 could be involved in cosmetology and barbering. And specifically, it would, there's the youth registered apprenticeship pathway. There's also approved programs by the Department of Labor and Industry. So if a Virginia Public School student, if their school district gets approval from Department of Labor and Industry, they could do externships. And then the third pathway would be for those students that have completed their program and have sought licensure, passed the competency exam, they would be able to work with their license.
Mr. Chairman, follow-up. Thank you for that. I did miss the or, and then probably most importantly, the three of us need to exchange where we go to the barber.
I was going to mention that we had the same barbers. So.
Any additional questions for the patron? All right, all those in favor of the bill, if you could please come close and speak your mind. All right, Secretary?
Mr. Chairman, members of the committee, thank you. Just here to support the bill. We've worked with Virginia Works and with Delegate Jones, and I think there were some unintended consequences when the language was transferred to the new Virginia Works agency last year. To give you an example, even right now, someone can be licensed by DPOR as a cosmetologist, but technically the law doesn't allow them to work as a cosmetologist. And this is just an attempt to clean up this language and so we can create more opportunities for young people. And this affects me a whole lot more than it does the three of y'all. So,
Thank you, Secretary Slater. Anyone else? All right, anyone in opposition to the bill? All right. No one online to speak in favor or opposition? All right, well, committee works by motion.
Move the bill with
Your microphone.
with amendment. Sorry, Mr. Chair, move the bill with amendment and refer to appropriations? Or
No.
Okay, move the bill with amendment.
Do we have a second?
Second.
All right, the bill is moved and seconded to with amendment. Let's go to the big board. All right, by a vote of 7-0, the bill is reported with amendments. Thank you, Delegate Jones.
Mr. Chair, members, thank you.
All right, let's go next to Delegate Ennis, HB 1749.
Thank you, Mr. Chairman. Chairman Lopez and members of the committee, good afternoon. HB 1749 would place a 45-day requirement on employers to issue a judgment on an employee's workers' compensation claim. This would keep employers from unnecessarily holding up a workers' compensation claim, keeping employees out of limbo and giving them a set timeline to expect a judgment. Without going into much detail, this bill came about from a constituent who required medical treatment. His workers' compensation claim was left in limbo for months, then denied, and the resulting appeal, which ended up approved, took months, adding additional treatments to be necessary. The claims on which would now have more delays. The entire process took about a year. There are a few exceptions added to the bill that give some flexibility to employers in processing claims. They include complications in receiving medical information, the employee needing extended evaluation to determine treatment, the need to consult with medical specialists to determine treatment, or any other exceptional circumstance that could justify an extension in the Commission's judgment. This bill would keep the workers' compensation process moving while not rushing important aspects of it for the employer. 45 calendar days is more than enough time to give the employer to process a claim and would give employees the opportunity to appeal a denial and receive the treatment they need in a timely manner. Thank you for your time, and I hope it is the will of the committee to report this bill.
Thank you, Delegate Ennis. Any questions for the patron? All right, anyone speaking in favor of the bill?
Mr. Chairman, members of the committee, Jennifer Pike, Virginia Professional Firefighters, and we support this bill. It affects our members.
Anyone else? All right, anyone in opposition to the bill? All righty, anyone online?
No, sir.
All right. Yo, Delegate Ballard.
Mr. Chairman, I'm just curious, if anyone's here from Workers' Comp, can they give some thoughts on how it may affect the Workers' Comp Commission?
Thank you, Delegate Ballard.
Thank you, Mr. Chairman.
Good afternoon, Mr. Chairman and members of the committee. If I may ask Delegate Ballard, do you have anything more specific that you need? My name is Wes Marshall, and I'm the chairman of the Virginia Workers' Compensation Commission.
Mr. Chairman, no, I don't have anything specific, but given that this affects directly workers' comp, I'm just curious if you're neutral, for, against, if you have any concerns about that timeline.
Thank you, sir.
Mr. Chairman and Delegate Ballard, there is potentially some overlap with this bill with an existing statute, 652602.1. It's not a perfect overlap of something that already exists, so this bill is more detailed. I do anticipate, in all candor, that there would be some fiscal impact for development and implementation of the additional requirements. In all candor, I don't think it is going to be, significant fiscal impact, and there would be some increased, if it was enacted, some increased administrative burden on our claims administration staff over time, over the years. But again, I don't anticipate that would be significant.
Okay. Thank you. Actually, while you're here, just a quick question. Is there a chance that when you have, for line 85, part 4, when you say that there are conflicting medical opinions that require additional investigation or mediation, wouldn't it be very easy to have conflicting medical opinions that would delay something beyond the 45-day period?
That occurs all the time. It occurs all the time. Typically, we see denials of medical treatment in sort of two situations. One, where an employer or insurer wants to conduct further investigation or get another medical opinion or request clarification from a treating physician. So there may be a delay based on that. And then the other situation where there is denial is there are conflicting medical opinions. One, the claimant's treating physician says an MRI is necessary to further diagnose a condition, and an employer's or insurer's medical examiner says, no, that's not necessary.
Also, in line 81, when it says the nature of the employee's condition requires extended evaluation to determine the appropriate treatment, can you give me an example of what that might be or how common that is already?
I think that would be that's very, very common. And that is a situation that I first described where a treating physician recommends something, surgery, diagnostic testing, referral to a specialist, and the employer or the insurer says, based upon our empirical studies, based upon our medical research, based upon our computerized automated guidelines, we don't think that treatment is necessary. Therefore, we are going to ask for some further evaluation on that. It may be the employer goes back to the treating doctor and says, why do you want to do this? Or why do you think this surgery is necessary? It may be that they want to go get a separate opinion because they want to ultimately challenge it. Very, very common occurrences.
It's unfortunately a common occurrence. And so, all right, so is there also any magic, sir, about the 45 calendar days?
No, sir, except that there is a 30-day requirement in the existing requirement, which essentially notice of sort of any disputes on a claim, 30-day requirement per 652602.1. So I say there's some overlap because under 602.1, if I'm an injured worker and I want surgery and my doctor says I need it, I file a claim with the Virginia Workers' Compensation Commission saying, please approve the surgery. That triggers off some of the 30-day notice requirements under 602.1. So 602.1 is actually potentially, depending on how you read it, broader or narrower than the proposed legislation.
Thank you, sir. I really appreciate your expertise, and thank you, Delegate Ballard, for bringing that up.
Additional
question, Delegate Ballard?
Please, Mr. Chairman.
Sure.
So follow up to, the way I read this is it's more about timeline of making a decision. It's not about denials or approvals. It's really the focus for this legislation is about the timing. Is that fair to say?
Mr. Chairman and Delegate Ballard, yes, that's fair to say.
Sir, would you also say, however, that with all of these exceptions, which the 5 fairly easily met exceptions, that the 45 days is sort of a, it's not that, it doesn't seem like anything can delay this beyond the 45-day threshold?
Again, while we don't, as the Commission, have a position on the bill, yes, these exceptions are, I would say they're everyday occurrences in workers' compensation cases, and they occur all the time.
All right, thank you, sir, very, very much. Appreciate your expertise.
Thank you, Mr. Chairman. Thank you, members of the committee.
All right, you said there's no one online.
No, sir.
Any additional questions for the patron? Mr. Delegate Ennis? Yes. All right, you have the last word?
No, I thought you
Good
had a
deal.
question.
All right, committee works by motion.
Mr. Chair, I would motion
Microphone,
gently lay this on.
microphone.
Again, I'm sorry, Mr. Chair. I would motion to gently lay this bill on the table.
Oh, it's moved and seconded. All right, let's go to the board. All right, by a vote of 5-2, the bill HB 1749 is laid on the table. Thank you. All right, Delegate Martinez, you have two bills. Hello, Delegate Martinez. Can you do with HB 1766, unemployment compensation first?
Yes, I will. And I think we all can agree, since the last time these unemployment benefits have been increased has been quite a while. But the cost of living, due to inflation and just the cost of doing business, has increased significantly. HB 766 is recommended by the Commission on Unemployment Compensation and is based on policy option recommendations from JLARC 2021. Report on the JLARC 2021 report on the Virginia Employment Commission. This bill is also identical to Senator Evans' SB 1056. This bill will increase unemployment insurance weekly benefit amount by $100 a week. And it directs the Commission on Unemployment Compensation in consultation with the Virginia Employment Commission to convene a work study group to study making annual adjustments, individually weekly benefit amounts based on the average weekly wage. The impetus for this bill is twofold. First, unemployment benefits are too low to assist workers in covering basic necessities. On average, a worker's benefit amount is just 1/3 of their prior wages. Weekly benefit amounts range from $60 to $378 per week. These amounts are set over a decade ago in 2012. The effective value of these benefit amounts has decreased sharply since then. Unlike 36 other states, Virginia benefit amounts do not currently increase based on a statewide metric. Second, Virginia benefits may be too low to prompt some eligible unemployed workers to apply for unemployment insurance compensation. Fewer than 14 out of every 100 employed workers in Virginia received unemployment benefits. This is not only bad for workers, but for employees, since unemployment insurance keeps workers attached to the labor force through requirements to conduct work searches, make job contacts, and accept suitable work. This bill is supported by a working group of social action linking together Virginia Poverty Center, Legal Aid for Justice Center, the Commonwealth Institute for Fiscal Analysis, and National Employment Law. We do have some of the stakeholders here who I will defer to questions, but before I do that, I always like to add my own personal experience. I was a government contractor for over 30 years in this DC area, and I was making good money. The problem is there's a saying that goes, you're only as good as your contract. And when I would go on unemployment insurance because our contract would run out and we didn't win the rebid, while I was looking for another job, $300, $378, I hit the maximum, was not enough to help me survive with a family of 5, especially when 3 of them are going to high school at the same time. So what I'm looking for is try to find a better way to help our unemployed. This area has a pretty high skill workforce. They don't make minimum wage. And when they're unemployed, they need help. And that is what this bill is attempting to do. Thank you, Chairman.
Thank you, Delegate Martinez. Do we have any questions for the patron from the committee? All right, anyone here to speak in favor of the bill? Once again, if you're going to speak in favor, please come up close.
Thank you, Mr. Chair. Sophie McGinley with the Commonwealth Institute. I'm going to share my favorite analogy to think of unemployment insurance like a spare tire for your financial vehicle. When you lose your job, it's like getting a flat tire on your journey. Just like spare tires are designed to be just good enough to get you to your mechanic safely, UI should be designed to keep you moving until you can get back on the road with a new job. But Virginia's spare tire is severely underinflated. Our maximum benefit of $378 per week, as you heard, was set over a decade ago and hasn't been adjusted since. For a tradesman earning the average Virginia salary of $58,000 a year, losing their job would mean UI benefits of at most $1,512 a month, less than half of their usual income and barely enough to cover just rent in many parts of our state, let alone food and utilities. This bill's $100 increase would provide an additional $400 per month to help cover these essential expenses. This isn't just about helping individual workers. When unemployed people can't afford basics, local businesses suffer too. Our UI system needs this update to fulfill its essential role as an economic stabilizer for our communities. I urge you to vote yes on House Bill 1766. Thank you.
Thank you very much.
Thank you, Mr. Chair. I'm Flannery O'Rourke, National Employment Law Project. I urge you all to support this bill. I think it's important to remember that unemployment insurance is insurance. So if your car or your health insurance paid out at 2014 rates that weren't even sufficient then, you would change providers. But even though studies find that employees ultimately bear the cost of unemployment insurance, they have no choice in providers. So it's up to the members of the committee to ensure the program is sufficient. The cost of living has greatly increased even since JLARC's 2021 report. So the benefit levels need to be increased. And fortunately, this is low cost. Keep in mind that Virginia has some of the lowest unemployment insurance taxes in the country, averaging just $2.30 per week. I'm going to spend that much just paying tolls to get here and get home today. It's not very much, and the impact to tax rates is going to be relatively low. So please, again, support this bill.
Thank you very much.
Mr. Chair, subcommittee members, I'm Joanna Darkus. I'm an attorney at the Virginia Poverty Law Center. We support this bill because UI benefit amounts must increase if our UI system is to achieve its principal objective of alleviating hardship for the unemployed. That objective aligns closely with that of the civil legal aid community and would help the low-income Virginians that we serve make ends meet. We urge you to support this bill and vote to advance it. Thank you.
Thank you very much.
My name is David Smith. I'm the Director of SALT, Social Action Linking Together, and for all the reasons that have already been mentioned, we support this bill. Thank you.
Thank you.
Pat Levy, Lavelle Legal Aid Justice Center. We support this bill. Thank you.
Thank you.
Jason Parker, Virginia State Building Construction Trades Council. We represent all of the labor tradespeople in the state of Virginia. There's an old saying that you're always working yourself out of a job in construction. Unemployment insurance is an important piecemeal part of the way we make our living. So we would hope that you would support this bill.
You can please keep it, we've already gone through our time. You can keep it fast.
Yeah, Doris Cross-Mays, President of Virginia AFL-CIO. I want to thank the delegate for doing that. We really need to do this.
Thank you.
Dr. Emily Yen, Virginia Caucus of Rank and File Educators, supports this bill.
Thank you.
Neil Gray, International Brotherhood of Electrical Workers. We support the measure.
Thank you. Anyone speaking in opposition to the bill? All right. Anyone online?
No, sir.
Okay, we have gotten a letter from the Speaker's office that this bill would have to go to appropriations if it's reported. So any more questions from the panel?
Mr. Speaker, or Mr. Chairman.
Delegate Runyon.
Yeah, a question of the patron, Mr. Chairman. With this change, do we know how it would impact the fund balance in the Commonwealth on their unemployment commission?
I have not got a fiscal impact statement from this yet, but as soon as we find out, we'll let you know.
Okay. Follow-up question.
Delegate Runyon.
Yeah, and while we're looking, I would also be interested in how it impacts the tax rate on the employers and how long that tax rate would have to be increased to meet the statutory requirements on the fund balance. I think these are, Mr. Chairman, I think these are important questions to answer before we add to benefits. Thank you.
Mr. Chairman, I apologize I didn't address you before on the previous question. But on this question here, we'll look into it. But as a person who worked and hired people, any increase in this tax will no way impact the operational and revenue generating. And I'll give you an example. I hire somebody at $120,000 and I have to pay unemployment insurance tax. I'm not going to not hire him because of the revenue he generates will more than compensate for any increase in the tax. As a fiscal person, economics major, understand those issues.
We have someone else
I'm sorry.
to speak to that question.
Flannery O'Rourke, National Employment Law Project. Mr. Chair and Delegate Runyon, thank you for the question. So when JLARC in their 2021 report reviewed the current tax scheme in Virginia, they found that it was sufficient to maintain a solvent trust fund, and we do have a solvent trust fund. The way that the taxes work is that the tax rate will go up the more an employer has workers that have qualifying separation. So not every separation would be qualifying, but if you were to lay off workers, then that would change your experience rating, which is just one factor that is how the tax rate is calculated. So there's not a concern about the trust fund solvency as an impact of this because the tax rate automatically changes in response to the benefit charges. And that already happened. So right now with the range from $60 to $378 per week, because the most recent employer is the one whose experience rating would be impacted, they could have two workers in the same position paid the same amount. One of those workers could be entitled to $60 per week. One of those workers could be entitled to $378 per week. It just goes into a formula that ensures that our trust fund is solvent. Thank you.
Follow Delegate Runyon.
I guess I would ask for some clarity, Mr. Chair. As I understand it, the unemployment tax has two components to it, an experience tax, and then all employers pay a base tax. And then if the fund balance falls below a certain threshold, there can be an incremental balance added to those employers. So an employer that has no layoffs will pay incremental monies to continue to operate in the state of Virginia. And so, again, my question or my concern is not whether this number needs to be adjusted. I just would like to know what it's going to do to both our commission balance, our fund balance, and to our employers. And I think these are important questions to answer. Thank you, Mr. Chair.
Thank you. Thank you, Delegate Runyon. I appreciate your expertise, ma'am. Thank you. Any other? Oh, Delegate Martinez, last word.
Mr. Chairman, I would like to apologize for being a little condescending. Your questions are on point, and we are going to take them seriously and try to do what we can to mitigate or at least answer the questions you've asked.
Thank you. All right. Committee works by motion.
Mr. Chair, move to report and refer to the Committee on Appropriations so they can answer that question.
Thank you. It's moved and seconded to move the report the bill and report it to appropriations. Refer to appropriations. Let's go to the big board. All right, by a vote of 5-2, the bill is reported and referred to appropriations. Thank you, Delegate Martinez. Now, Delegate Martinez, you have another bill, 1767. You have the floor.
Yes, Chairman. Thank you again for recognizing me on these bills. HB 1767 comes from a recommendation from the National Employment Law Project. This bill sets the maximum potential benefit duration for unemployment insurance at a uniform 26 weeks for all claimants. The maximum potential benefit duration is the total number of weeks a worker can receive weekly benefit payments if they meet multiple requirements for each week. For each week, they have to make a claim for benefits that week, meet all weekly requirements for unemployment insurance, including weekly work searches and job contacts, remain unemployed and unable to find suitable work. Under current Virginia law, a claimant's maximum potential benefit duration ranges from 12 to 26 weeks. A claimant maximum potential duration within this range is not determined by whether the claimant remains unemployed. Instead, it's determined by the ratio of the claimant's highest two-quarter earnings to their total earnings during the year-long base period. This does not make sense as unemployment rates and duration vary greatly by region, industry, and demographic characteristics. Over the past 2 years, roughly half of Virginia claimants were entitled to the 26 maximum potential benefit duration. Setting a uniform maximum potential benefit duration will ensure our law is more sensical and fair so that all Virginia claimants receive support for the weeks they need it. Ensure the local economy does not suffer as much from large layoffs. Household spending plummets in direct relationship to the loss of unemployment insurance benefits. Thus, by setting the maximum potential benefit duration at 26 weeks for all claimants, this bill does not and cannot extend the period in which a worker is unemployed. Instead, it ensures that Virginia claimants and the Commonwealth economy don't go broke when suitable work takes a little longer to find. It is no wonder that West Virginia, D.C., and Maryland have already have a uniform 26-week maximum potential benefit duration. I also believe we have the stakeholders here that I will defer to them for some of the questions asked.
Any questions for the patron? All right. Anyone speaking in favor of the bill?
Good afternoon, Mr. Chair. Again, I'm Flannery O'Rourke, National Employment Law Project. I want to tell you about a worker up in Charlottesville. She's a single mom, bought her own home a few years ago. Last October, she was laid off from her job of over 20 years. That was 11 weeks and 5 days ago. But who's counting? Well, our unemployment insurance system is. Job postings slowed around Thanksgiving, and no employers or recruiters were getting back to her over the winter holidays. And the snow closures didn't help. But she keeps applying, and as of yesterday, she had applied for 123 jobs. In the 11 weeks and 5 days, she's gotten a couple of rejections. She's had a couple dozen interviews. Yesterday, she called and she said she might have a part-time job lined up, but they need to do a clearance check first, and that's going to take 6 weeks. Saturday will mark 12 weeks, and for many Virginia's unemployed workers, that would be it. Their insurance protection would be up. This bill does not extend the time that workers are unemployed. I'm sure the members don't want that. Workers don't want that. Instead, this bill simply ensures all Virginians have the same protections when their time being unemployed is extended due to factors outside of their control. Thank you. Please support the bill.
Thank you.
Mr. Chair, for the final time today, I promise, Sophie McGinley with the Commonwealth Institute. As you know, the current number of weeks someone can receive benefits fluctuates between 12 and 26 weeks. This creates unnecessary uncertainty for both workers and employers. Someone who loses their job during a period of low unemployment isn't in any less need of time to find suitable work. The reality of today's job market is that finding appropriate employment often takes months, regardless of the overall unemployment rate. Workers need time to search for jobs that match their skills, complete multiple rounds of interviews, and potentially undergo training or certification. Cutting off benefits at 12 weeks can force people to take the first job available rather than the right job. We should join the majority of surrounding states that provide a standard benefit duration. This gives workers reasonable time to find appropriate employment while maintaining clear, consistent expectations for both employees and employers. I urge you to vote yes on House Bill 1767. Thank you.
Thank you.
Mr. Chair and members of the subcommittee, thank you so much for your time. My name is David Smith with Social Action Linking Together. As my colleagues have said, for all they've said, we support this bill. I'd also like to add that as the son of a West Virginia lady, I feel like we as Virginians have the ability to do something as well as West Virginia does. So I encourage you to vote for this bill.
Hear, hear.
Mr. Chair, I'm Joanna Darkus from the Virginia Poverty Law Center. We support this bill and urge you to support it as well.
Thank you.
Mr. Chair, subcommittee members, my name is Pat Levy-Lavelle with Legal Aid Justice Center. We support this bill. Thank you.
Thank you.
Jason Parker, Virginia Building Trades, we support.
Thank you.
George Krause Mays, Virginia AFL-CIO, we support the bill.
Thank you.
Neil Gray, International Brotherhood of Electrical Workers, we support the bill.
Thank you.
Dr. Emily Yen, the Virginia Caucus of Rank and File Educators, supports this bill.
Thank you. All right, anyone in opposition to the bill?
Mr. Chair, members of the subcommittee, Ashley Irvin with the Virginia Employment Commission and the administration opposes this bill.
Thank you very much. All right, this bill will have to be, we also got a letter on this bill from the appropriation, to send it to appropriations from the Speaker's office.
Mr. Chair,
Yes, Delegate Runyon.
may I ask a question?
Yes.
Thank you, Mr. Chair. To save time, same two questions as before. How does this impact the fund balance? How does this impact the tax rate the employers pay? Thank you, Mr. Chair.
Mr. Chair, I'll defer to the.
Yes, that's fine.
Thank you, Mr. Chair. Flannery O'Rourke, National Employment Law Project, Delegate Runyon. Thank you for the question. So essentially same answer as before. Our system is already set up. About half of Virginia's unemployed insured workers are already qualified for 26 weeks of benefits. And so the benefit charges, if they claim all 26 weeks, they remain unemployed and qualified for benefits for the whole 26 weeks. If they claim all of that, then those benefit charges are charged to the given employer. This would just make it so that the 26 weeks potential duration was available to all workers, not just some workers.
All right.
Thank you, Mr. Chair. A follow-up?
Yes,
it's really a comment. And what I'm getting at, this is going to spend more money in the plan, in the fund balance. And so, again, it's important to me to understand, for us to move forward, what those dollars are. And I understand that people that already get 26 weeks won't get any more, but there is a group of people that will have more benefits paid, and so that's going to cost the Commonwealth of Virginia collectively more money. And that I think, is the point that needs to be considered in this. Thank you, Mr. Chair.
Delegate Ballard.
Thank you, Mr. Chair. You mentioned in your comments that if we pass this, we would join the majority of surrounding states. I heard Maryland, I think maybe from the patrons' comments, and D.C., and it sounds like West Virginia may be similarly aligned. Can you tell me what states that we would join?
So North Carolina also has a uniform benefit duration where it's the same benefit duration for all workers.
Thank you, ma'am. All right, there's no one online. Committee works by motion.
Move to report and refer to the Committee on Appropriations.
Second.
Bill has been moved and seconded. Let's go to the big board. All right, by a vote of 5-2, HB 1767 is reported and referred to appropriations. Thank you, Delegate Martinez.
Thank you, Chairman, and thank you to the subcommittee for listening and supporting.
Appreciate it. All right, Delegate Arnold. HB 1851.
Yes, sir. Thank you, Mr. Chair, members of the subcommittee. HB 1851 would amend 65.2-402. That's the presumption as to death or disability from respiratory disease, hypertension, or heart disease, cancer, by adding sheriffs and deputy sheriffs to the list that would receive the presumption currently afforded Virginia State police officers and firefighters alike. This bill came at the request of my local sheriff's department. There are a number of deputies currently serving in that department and across Southwest, and I presume across the Commonwealth, that were on the front lines of the methamphetamine epidemic of the late 90s and early 2000s. These were deputies that were infiltrating, destabilizing, and ultimately destroying clandestine methamphetamine labs. These labs were not what you would see on TV. They were not operated by Walter White. These methamphetamine labs were using red sulfur matches, Coleman lantern fluid, battery acid, Sudafed, and other ingredients to make a highly combustible substance that was ultimately rendered into illicit methamphetamine. There's a number of officers that were detailed to the Virginia State Police Task Force and the DEA Task Force that was involved in battling this form of methamphetamine. This would simply offer protection to those that protected us during that time. Welcome any questions the subcommittee may have.
Any questions from the committee? I have one quick question. Could you explain, when you say they're exposed, could you explain how that would have happened?
Well, it could happen in a myriad of ways. Usually, it could happen after an investigation, so they have some kind of idea that they were going in. This was mostly fumes, liquids that they would be exposed to. Sometimes an arrest would be made in a house that you would have no indication that there would be any type of methamphetamine production ongoing. And then you have an officer in there with no protection who's been exposed to this. At the time, again, you're talking 20, 25 years ago, at least in my district, you were having, hotel rooms explode, trailers catch fire. This was a pretty toxic substance that these individuals were operating with generally a minimal understanding of basic chemistry.
Thank you, Mr. Delegate Congress Fowler.
Thank you. Mr. Chair, so last year I had a bill about this because we had a jet spill when there was a jet crash in Virginia Beach, and it was about city employees who cleaned up that mess and who later there were issues with their health and with cancer. This bill applies to sheriffs and deputy sheriffs, which I believe now, and our lawyer could confirm, but I believe that this actually does apply to state police, which would make sense because we're the state and we're kind of paying them. The sheriffs and their deputies are in a weird middle, just because I know because my husband was a deputy, so like weird middle territory where who is paying them, who do they work for, who, those kind of things. So it almost is an interesting, like, how do you approach that when who's really accountable for this compensation or the insurance, who would have to use their insurance? I guess, Mr. Chair, is the question I would ask. Would it be through the sheriff's department? Would it be through the locality? Would it be through the state? How would that work?
Delegate Arnold.
Thank you, Mr. Chair. Mr. Chair, I would answer the delegate by saying I have been informed today that would be an issue most likely for the localities, and then you have some localities that are self-insured, so they would be responsible for it. That has been my understanding.
Follow-up, Mr. Chair?
Delegate Congress Fowler.
So, of course, I want our law enforcement to be, Mr. Chair, be protected, especially when my husband was one. But I don't, if this bill is going to be an unfunded mandate, I don't believe I can vote for it. And I think it appears that it is an unfunded mandate from what the information the patron just said. So maybe you could clarify. It is something that the localities would have to do.
Mr. Chair, I would answer the delegate by saying my understanding is that it would be the insurance companies that cover this. I may be incorrect. I may have misunderstood what was said. But that's the best answer I could give the delegate. Right.
The insurance company would cover it. Any additional questions or comments from the panel? All right. We also have a letter from the Speaker's office to go to, if this bill is passed, it would be referred to appropriations. Anyone here to speak in favor of the bill?
Sorry, John.
Mr. Chairman and members of the subcommittee, I'm John Jones, representing the Virginia Sheriff's Association, and we want to thank the Delegate Arnold for bringing this bill forward. These deputy sheriffs are routinely subjected to this substance. They dismantle, these drug-making devices, and they dismantle the meth labs. They're exposed to the same substances, basically, that everyone else listed in the bill is. The sheriffs have primary law enforcement in 86 of the counties, and they're right there on the front line with the folks that are covered with the bill. So we're looking at it as a sense of fairness, and we hope you'll move it forward. Thank you.
Thank you, sir. Anyone else? Anyone in opposition to this legislation?
Mr. Chairman, members of the committee, Jeff Smith here on behalf of the Virginia Self-Insurers Association, as well as Metis Holdings, a company that oversees VACO's risk liability pool. I want to thank the patron for letting us come by, discuss our concerns with him. We do have a lot of concerns with the bill. Historically, when we add cancers to the presumption in the code. There's significant scientific research that's done, and there was a World Health Organization report as part of that where there's research that's done, it's peer-reviewed, it's done again, and that is backing, which relates, those certain cancers back to the certain occupation. We are not aware of, I'm sure there's a study out there, but there's not the substantial scientific research that you see on the firefighter side. The second thing that I'll add is there's probably 60% more deputies than firefighters. So we talk a lot about the cost as we add cancers for firefighters. That number would be significantly higher on our end. So we respectfully ask you to oppose the bill.
Quick question, sir.
Yes, sir.
Could you please tell me what would be sufficient medical data and background to trigger your being okay with this being added to the code?
There was a JLARC study from 2019 that actually asked, or one of the recommendations that they had was adding to the code a provision as it relates to cancers and presumptions, that there be a provision in the code talking about the quantity and quality of the scientific research as we add or modify cancers. I don't know if there's, it's not a perfect answer to your question, but I'm not sure there's a magic number on the scientific research, but I can tell you on the firefighter side, there's significant research out there. So, and we've, historically looked at it as new research comes out on other cancers as well.
Delegate Conversfellow.
Mr. Chair, I just want to add a question for the self-insured community. Sure. What is that? So do you have the answer to the question of who would have to pay? Like, is it, when you say self-insured, so that department probably would be, or locality would end up paying the insurance to cover this?
Well, at the end of the day, the localities that are self-insured would pay that, but traditionally they'll get a policy through a larger insurance company as part of the self-insurance that they have, and then others that are part of a risk pool, those will, the localities are paying for the insurance. But
thank you, sir. You have speaking in opposition, sir?
Yes, sir. Mr. Chair, members of the committee, good afternoon. My name is Jeremy Bennett, representing the Virginia Association of Counties. With respect to the patron, we're not opposed to the intent of the bill, but we do have concerns raised by the risk insurers about the cost that would be passed on to local governments. For those reasons, we're opposed to it.
All right. Thank you very much. Anyone else in opposition? All right. Any more questions or comments from the committee? All right. The committee works by motion.
Mr.
Chairman, move to report.
Second. Mr. Chair, I have a substitute motion based on the testimony. This is very simple, very sympathetic, but I move that we gently lay this bill on the table so we can work on it and make sure we address all the issues around cost and funding for future years.
Okay. So, all right. Move to gently lay the bill on the table. It was moved and seconded. Let's go to the big board. All right, by a vote of 4-2, the bill is tabled. Thank you very much, Delegate Arnold.
I thank the chair and the subcommittee.
All right, our last bill of the meeting is Delegate LeVar Bowling. Would you like to do it here or up there? There you go. HB 1933, once again, with our last bill, we have another letter from the Speaker's office. If we do report this bill, it will be referred to appropriations. Delegate Bowling, the floor is yours.
Thank you. Thank you, Mr. Chairman, members of the committee. So HB 1933 proposed an amendment to the code where we're expanding the workers' compensation law to include a more in-depth definition of throat cancer within the list of occupational diseases that is suffered in the line of duty for those eligible workers. This includes our salaried or volunteer firefighters, those that come in encounter with hazardous materials, and other specified personnel in that section. The bill provides that for the purposes of workers' compensation presumption, as to death or disability for certain types of cancer, throat cancer would now be identified in the tissues of the pharynx, the larynx, adenoid, tonsil, esophagus, trachea, nasopharynx, oropharynx, and the hypopharynx area in the throat. This definition expansion is definitely needed because first responders risk their lives in our communities. We know this all across the Commonwealth, and they are experiencing difficulties in receiving the care that they need due to the denial of coverage and claims because of the strict interpretation that we currently have within the code in regards to throat cancer. So this bill is a companion bill to SB 290, which did pass unanimously in Senate Commerce and Labor 15-0. And on behalf of our first responders, I please ask you to report the bill and refer it to appropriations. And I do have some experts here who can speak to the bill.
Thank you, Delegate. Any questions or comments from the committee? All right. Anyone here to speak in favor of the bill?
Mr. Chairman, members of the committee, Jennifer Pike with the Virginia Professional Firefighters, and we ask the delegate to submit this bill for us just to provide clarity. Our members are being denied claims. They're already fighting the cancers, and they shouldn't have to fight the insurers as well. So we would appreciate a supported vote for this.
Thank you very much. Anyone else not in support? Once again, please come close.
Sorry. Mr. Chairman, members of the committee, Jeff Smith, we, Metis Holdings as well as Virginia Self-Insurers, we agree with the comments from Jennifer that it provides clarity in the process, and we think it'll speed that up. So thank you.
Thank you, sir. Anyone else? And anyone in opposition? All right. Anyone online?
No, sir.
All right.
Second.
All right, moved and seconded. Let's go to the big board. All right. There we go. Sorry about that. You can walk. By a vote of 7-0, the bill is reported and referred to appropriations. Thank you, everyone. We are adjourned.
Thank you, Mr. Chair.